Recently, 2 interesting HCV studies on the real-life practice in Belgium were published. In a first study, Dr. Bielen introduced some new prevalence data. He tested more than 2,000 patients who presented themselves at the emergency department at the hospital in Genk. They all gave a blood sample. The laboratory results give us a good idea of the prevalence of hepatitis C RNA in that region.
1.31% of the patients was positive for hepatitis C antibodies. But if you look at the RNA, only 0.5% was chronically infected. So a bit of the patients were treated in the past. Some of the patients were spontaneously cured. But none of these patients that were chronically infected actually were in follow-up. So it was necessary to retest them again. And in our study, drug users, and especially intravenous drug users, people who have ever been in prison, and people immigrating from high endemic countries were at the most risk of hepatitis C. And so if we want to reach the WHO treatment targets for 2030, we need to start screening in those populations.
Indeed, we have to screen better. But what about the follow-up of already screened patients? Well, Dr. Verlinden presented a poster on patients who were lost to follow-up. He reviewed 500 patient files, all patients that were referred to him or his colleagues for HCV treatment.
We saw that up to 30% who were in our care did not show up for a follow-up appointment. So that's a huge amount of patients. So after going more in depth, we saw that up to 40% luckily was followed somewhere else, but still 60% of those patients were completely lost to follow-up. So we tried to reach out to those patients and to the GPs, and luckily we were able to recover up to 40% of those patients back into our follow-up. The second part of our study, we looked at other disciplines. So we looked at what happens to patients with positive hepatitis C antibodies, but that were requested by a non-gastroenterologist or non-hepatologist. And we saw that up to 30% of the patients that needed referral were not referred, and the result was not even mentioned in the discharge letter. So it's a huge amount of patients as well. We learned with this study that loss to follow-up is a big problem in our hepatitis C community, and with some just reviewing the files, we're able to recover a lot of those patients.